Hi. How are you today? Good, good. Glad you could come in. I'm doing very well. Thank you very much. Thank you for asking. Well, my name is Dr. Grover. Gross. Call me Gross. Everybody does. So, I understand that this is your first time. Mm-hmm. Okay. Okay, well, we're always accepting new people, so new patients. So, I'm glad that you stopped by. It's actually kind of interesting, kind of odd that you have to stop by at the time that you did, because we just had a patient cancel and change their appointment. So, yes, I know. Yeah, it's kind of funny how things like that work sometimes. So, anyway, like I said, welcome. From what I understand, you're here for a general cleaning, kind of a consultation, general cleaning type thing. So, we'll get started and things like that. So, first of all, let me kind of explain a little bit. First of all, I know that from what I understand, you had been to the dentist before, but I guess you'd had some issues with your previous dentist, I guess. Mm-hmm. Okay. Okay. So it wasn't like anything, real serious, like health related issues. No. Okay. Okay. So it was like insurance. Okay. Okay. So basically, your insurance company kind of changed their policy and could no longer cover your dental expenses, and with that particular dentist, and so you needed to change. Okay. All right. Well, just so you know, first of all dental visits are cleanings are like about $25. So, and that's a flat rate. I mean, for adults. Kids, it's like I think like $10. I think. But for adults, it's about $25. And really, quite frankly, you can't beat that anywhere. Really. I suppose maybe you could with maybe $15 or $20. But realistically, when you think about what most dental offices charge for cleaning, it's quite a bit. So yeah. Now, I will tell you one thing. We do have an orthodontist here, so if you should ever need like braces or anything, our orthodontist here can provide that kind of service. And we've had a lot of patients that have needed that kind of thing, and they have all turned out fabulous. So, good results. So she does very well. So, anyway, so right now I'm going to kind of get down some general information, and then we'll get started. Alright? Yep. So, first of all, can I have a name? Okay. Let's put Amy. Okay. Last name? Address. Okay. And that's your intent, I presume. Yeah. Or thereabouts. Okay. Okay. Medical history. Are you taking any medications currently? Okay. And how many milligrams of that? 2. Okay. Anything else? Okay. Okay. Do you know the name of the medication? No. Okay. Well, that's fine. Okay. Anything else? No? Okay. Who is your family physician? Okay. Okay. Amy, have you been having any trouble, like, with your teeth at all? Anymore? Okay, so you've been experiencing sensitivity. Okay. Is it like temperature sensitivity? Biting pressure? Like sensitive to biting pressure? What? Okay, so kind of a bit of both. Okay. So basically overall sensitivity. And is that on both sides? Both sides of your mouth? Or is that on one side? And if it's on one side, which side? Okay, overall, so both sides. Okay. Look. Alright. Alright. Well, Amy, we'll go ahead and get started. And see what we got. Alright? How about that? Yes, come in. Oh! Hey, Daniel. Come on in. Just getting started. Danielle, this is Amy. She's patient. Amy, this is Danielle. This is one of our dental assistants. Danielle has been working with us now for very close track. 4 years. 4 years. And she's very, very accomplished. So Danielle is going to be helping me out today, and we'll go ahead and get started. We're gonna take a look and see what we got. Tools up here. So this is just a mirror. You've seen one of these before. Kind of take a look, see what we got, see what the situation is, and we'll kind of go from there. Okay? Alright. So can you open that bag for me? There we go. Thank you very much. Okay. You'll go just a little lighter for me. There we go. That's it. Hmm. So we're on the other side here. Okay. Alright. Amy, this is a question we ask everybody. How often would you say that you brush your teeth? How often would you say you brush your teeth? A day? Okay, at least twice? Okay. You floss? Okay, how many times? A day? Okay, you try to do it at least twice? Okay. Twice a day. Okay. You do, okay. One thing that I noticed, and it's kind of patchy, but it may not remain patchy. You have some patchy inflammation along your gum line, both top and bottom, and that's partially due to the fact that, you know, I don't know if you maybe irritated it when you're eating something, you know, like chips or something, because when you crunch on chips, you know, they break, and then, or pretzels or something like that, where, you know, they break and then pieces of the chip can hit your gum and kind of irritate it. Okay. Been there, done that. And so I don't know if you did it that way, or if it, because it also comes from, you know, neglecting the toothbrush, you know, not using it as often, and so you said you've been experiencing a lot of sensitivity, and one of the areas that I'm noticing that you've got some of that inflammation is right up here along that canine right up in here, like right up in here. You've got, and that, like I said, it's top and bottom, and it's on both sides in the same areas, or relatively the same areas. Is you've got excuse me. Wait. You've got that inflammation is up around that particular tooth on both sides and kind of around that area. And, you know, what I imagine is the case, of course I'm not you, but, you know, kind of assessing based on what I see, what I would imagine is the situation is when you chewing food or drinking or something, and like for instance if you're drinking something and that liquid kind of sits in your mouth a little bit before you swallow it, especially if it's cold, it will kind of cause some sensitivity issues with that tooth because of that inflammation, being up around where the root of the tooth is, being up around that area, that makes the tooth very sensitive. The inflammation of the gum tissue makes the tooth very sensitive because that tooth is anchored into the gum. So if the gum gets inflamed, if the gum tissue ends up being inflamed, then that affects the tooth. So, and that's why you have to be careful with things like that. And I realize it's hard to help, hard to avoid, but excuse me. Just kind of letting you know there. Now, we're not going to do x-rays today, but I would imagine it's been a while since we've had some done. Okay. I thought so. And like I said, I saw that information on both sides and both the top and bottom. So what I'm going to do is I'm going to go in and clean. And I'm going to try and be as careful as I can with those inflamed areas. And I may be asking Danielle to make some notes of things. I'm just kind of letting you know that. Okay? Alrighty. Alright. So this little tool, I'm sure you've seen this before. This little tool is it's kind of a little pick, kind of used to get in between the teeth and kind of get the stuff off, kind of stuff up from in between there. If you open wide, we'll get started. Alright? You ready, Danielle? Okay. Alright, so open wide. I'm going to start up on the top left. Okay? Alright, open wide. area, so I'm going to try and be as gentle as I can. Okay. Go ahead and rinse that. Daniel, make a note of this. First of all, make a note that we need to do her x-rays next time she comes in. Second of all, and also we need to call her former dentist, her previous dentist, and see if we can get her last set, her most recent set of x-rays. In other words, her last set of x-rays. See if we can get those from them. Okay? Yeah, I just really forgot what I was going to say. Wow. Yes, thank you. Something else I just noticed, and I think I kind of saw this when I was looking at the mirror earlier. Amy, you have another thing that might be contributing to your chip, or not your chip, necessarily, to your sensitivity, is you have a tooth, I think like two, it looks like 3 teeth back from your canine, about 3 teeth back from that on the upper right. It looks like you've got a tooth that is chipped. And so, you, so that may actually be contributing to your chip, or to your sensitivity, and we need to get that fixed before that gets worse, before that gets any worse. Okay, so I need you to open up for me and we'll continue going. If you're ready. You ready? Okay. Ready then, Neil? Okay. Alright. It's okay, you're doing fine. You're doing great. Alright, go ahead and rinse that. Okay. And I'm going to start on the lower left, the lower right, and work my way around. Alright? Okay. And go ahead and rinse that. Yep. Nope. Thank you. Nope, you're doing fine. You're doing absolutely fantastic. Alright, go ahead and rinse that. Alright. Alright, so alright, so we have your teeth cleaned. Okay. Now, as I said, we're gonna have to do your x-rays during your next appointment. Now, one of the things, because this is also kind of a consultation, but one of the things that I would, do you use a manual or electric toothbrush? Electric, okay. I would recommend that you use a manual toothbrush, and the reason for that is because you control the toothbrush. You guide the toothbrush. And I want to set some goals for you for next appointment. And by the way, that reminds me, what days are best for you as far as appointments? Okay, so okay, so Wednesday, or no, I'm sorry. Oh, Thursday. Oh, okay, and Thursday, and then the weekends. Okay, Thursday. Okay, let's see. Um, let's see here. It looks like on Thursday, it looks like I have an opening for 11:30 in the morning, and I have an opening for 2 o'clock in the afternoon on Thursday. Now on Saturdays, we're only open till like I believe like 3, maybe 3:30, I think, on Saturdays. So, and on Saturday, I think I've got an opening for Thursday. So Thursday. You want the 11:30 or you want the 1:30? The 2. 11:30. Okay. So that's Thursday, and that's Thursday the. So Thursday the 24th. So Thursday the 24th. Okay. Now, I want to set some goals for you. First of all, I want you to start trying to brush, at least try and start brushing 3 times a day if you can. And same with the flossing. Okay. And like I said, it's only like $25 a visit, so you just pay that up front, and that'll be that. So, um, so yeah, and like I said, you know, we try and you know, adhere as much to our patients' needs as possible. So, we look forward to seeing you on the 24th. All right. Well, you have a good one.